the top health topics searched by Americans, one of the top questions is, what is diabetes? Type 2 is where you have caused yourself to not produce insulin anymore, so that you need that in order to function. And so we talk about one of the most common things that we can avoid in this country. And I think there's just lack of awareness on how it works. Anytime, whether it's processed sugar or natural sugar, anytime that hits the mouth, the process starts. And we remember learning this in school. The pancreas is the organ that digests sugar and helps regulate the sugar intake. So we have cells in our pancreas called beta cells that increase the insulin production in the body as soon as sugar enters the system. So if we override that with too much sugar at once, that's overriding those beta cells. So say, like we talked about before, 30 grams or less for the average human. If we're consuming 120 some grams of sugar a day, which it is common, that is happening, that beta cell, it's like a freaking casino in there, man. Just ding, 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 ding. It's rolling and rolling and rolling. And so what happens to anything, if, again, matter has limitations. So that those beta cells in the pancreas secreting insulin, they call it beta cell burnout, where those beta cells are done producing insulin because we've abused the body's natural ability to produce insulin. That's where type 2 diabetes comes from.
Ooh.
So if we can avoid that with limiting our sugar intake, being aware of how much we're consuming, and exercise, and that's another big factor too. What Michael Phelps, he ate like a madman when he was training for the Olympics because he was burning off so much. So if we're not burning off anything, we're just storing away sugar, it turns into fat, and then that's really the probably the biggest health problem in this country right now.
Yeah, and basically in very, very simple terms, you're basically just fatiguing out your cells.
Yes, exactly.
You are making decisions to eat certain things that makes the things that in your body makes everything go around. You're making them so tired that they can't do their job anymore.
They can't do their job. And not only that, but so like we were talking about, like say you have 60 grams of sugar in one setting, those beta cells are just pedal to the metal. They're wearing them out. I mean, it is just like any overacted system. An engine blows in a car, it's because it was overacted. And with the consumption of sugar, and then the lack of any type of process or exercising to that,
Yep.
or like you said, the timing of it. So if we don't give ourselves at least 8 hours for those beta cells to relax and rejuvenate, then we're just flooring it to the hammer even more. So that's why fasting is so important.
Well, yeah, and fasting helps out with people who have type 2 diabetes, and also with some exercise helps out people with their sugar levels. That's why it does.
Yeah, and I think staying in our lane here, it's kind of when you go to that doctor's appointment where you're pre-diabetic, quote unquote, where you're on your way to be a type 2 diabetic. A lot of the times I don't recommend any type of fasting or that to someone who's already been diagnosed with diabetes or has been prescribed metformin. That's when it's a different ball game. You need to go to a nutritionist and balance things out a little bit. But type 2 diabetes is reversible if done correctly, which is pretty amazing.
Yeah.
No medication.
You just have to be diligent and
Yep.
and resilient and get it done.
Yep. And it's just being aware. And we can start with step number 1, looking at the nutrition labels.
Yeah, and if that thing has a big old, you can basically cross it out. If you look at the ingredient list, and that thing is a massive paragraph, it's
and you can't pronounce the words. Get out.
Yeah, it's a pretty good indication of what's in that.
Stop, drop, and roll.
Yeah, stop, drop, and roll. Yeah, the thing would probably catch on fire.
Yeah,
it's like jet fuel.
And I think again, it's just not avoiding them completely, but moderation, being aware, and then exercise. And you got to drink water. And here's the other thing is soda. You go from drinking regular soda to diet soda, there's still a bunch